On Monday, the Prime Minister will be meeting with chief ministers of all states to discuss the country's vaccine rollout plan. With India on the brink of a COVID shot, the government announced CoWIN app for registration. Now, a dubious network of fake vaccine apps has been unearthed, mimicking the official app. These fake versions are asking citizens for their details in the name of COVID immunization. Here is our lead story tonight.
Countdown to the rollout.
वो है कोविन। ये एक डिजिटल प्लेटफॉर्म है जो कोविड-19 वैक्सीनेशन की डिलीवरी को रियल टाइम पर मॉनिटर करेगा।
When India's digital platform for vaccine distribution, CoWIN, was announced on December 8 as part of the preparations, the cyber scammers swung into action. A counterfeit portal with the same name popped up the very next day. On your screen are the snapshots of web page hosting a fake CoWIN app. With the help of digital forensics firm Voyager Infosec, we analyzed this app, its behavior pattern, through reverse engineering. The app looked suspicious to expert eyes.
When we analyzed, we found that this app has been taking suspicious permissions for your storage, for location access, etc. And right now it is operating as a clickbait app for getting some fake advertising revenue. It is likely that as soon as the government launches in public, this app will also start collecting Aadhaar data and other data of people and the banking details to conduct scams.
Further forensic investigation revealed that this network had a history of creating dubious portals, which mimicked official platforms. Our investigation showed that a single network was linked to the shadow pages of both CoWIN as well as the Securities and Exchange Board of India. The footprints of this camouflage were traced to a digital marketing firm located here.
India today has managed to track down the exact address from where the fake CoWIN app was allegedly being managed. This is C35 ground floor metro apartment in Jhotwada, Jaipur.
We found the place locked, and neighbors say it's been so for a month now.
कितने समय से ये जो नीचे वाली अपार्टमेंट है बंद पड़ी है?
सर ये 1 महीना हो गया, मतलब
1 महीने से बंद पड़ी है। तो यहाँ पर क्या कुछ चल रहा था या कुछ क्या फंक्शन कर रहे थे लोग?
नहीं सर, यहाँ कोई नहीं आया 1 महीने से, तो बंद पड़ी।
With one of the world's largest COVID immunization programs set to begin, it's time law enforcement took stern action against scammers.
The CoWIN app is meant to ensure that registration for COVID vaccine can happen, but clearly some fake scam or fraud was being orchestrated from this address in Jaipur so as to dupe people in the name of COVID vaccine. With Nikhil Sharma and Ankit Kumar, Devankur Vadhavan in Jaipur, India Today.
Joining me on the Newstrack at this moment is Professor S.K. Sareen. He's the director of the Institute of Liver and Biliary Sciences. Worked with the Delhi government earlier as an advisor during the COVID pandemic. With us also is Jitin Jain, one of the country's top cybersecurity experts. Professor Sareen, I come to you first. This investigation done by our open source investigation team shows how these fake apps have been set up. They're trying to use this opportunity to extract information from gullible citizens who think that if they register, they'll somehow be in the queue and on the priority list to get the vaccine.
This is a new challenge, which is not part of either science, technology, or policies. And I thank you and your team that you have found out such a thing. And this is a beginning of warning to people not to do it. It's not good. All of us are supposed to be benevolent, supposed to save others to save yourself, rather than to save yourself and then let others die. This is not fair. So I think it is illegal if this is found to be so, and we should not encourage it. I think we have to wait. The vaccine supplies are closely monitored, and I do think India would have enough supplies. Just have little patience. Those who have fought in the front, the army, the doctors, the healthcare workers should be given a priority. They're putting their neck out all this time. And we all know salvation is through vaccination, but wait for your turn for salvation.
Now, Jitin Jain, in this investigation, the app is operating as a clickbait app to try and get advertising revenue. They know that this is what people are looking for. And apparently, from the investigation that you helped us do, it turns out that it's not a first time. This particular company and the people behind it seem to align with whatever the government scheme or policy is, come up with similar sounding names, and have been doing this in the past as well.
Rahul, there are three things we must know to put the entire context together. One, they registered this domain with the exactly same name of what has Health Ministry has announced, the CoWIN domain, in the December. So they knew almost a month in advance what is going to be the name of domain. They had some information. Second, this is right now a clickbait advertisement app, but this is because right now government has not yet launched the vaccination program. Once the government starts vaccination, these people will also start collecting Aadhaar details and bank details. This is how the entire modus operandi of all scamsters are. And then they created a similar fake mobile app on the name of CoWIN. They made a website, and you would be surprised to know that once you broke the story yesterday on a web portal, they first changed the website to say that we are not the official website, as if they were the distributors or something. And then now they have taken off the domain. See, the problem is not whether some scamsters are going to steal some money, con some people, or run a malware campaign or a fake app. There is a bigger threat over here. The threat is that the whole process what government is ideating, that people would have to install an CoWIN app, and then they would have to link their Aadhaar card and medical records, and then they will be allotted a preferential vaccination as per the policies of the government. So if some people or are getting into this business of scamming and conning by running fake apps, it will lead to the complete erosion of trust in digital ecosystem. You must understand that 40 to 45% of smartphone users are in India are the first time users. They may have Harvard degrees, but they are not digital. They don't have digital literacy. They fall for these scams, loan apps, Nigerian scams, lottery frauds. So if this sort of new infodemic spreads, where fake COVID apps are operating, then the real problem government is trying to solve by easing the entire process and putting records together and making it easier via mobile app. There will be a complete erosion of trust in that entire ecosystem even before it has started.
Okay.
So I think that's the bigger challenge here, that if you don't stop it now, then the bigger objective of running a smooth delivery of vaccination in India will be affected.
So today was a big day in India's vaccination rollout plan. The biggest nationwide dry run was carried out in 686 districts across 33 states and union territories. Thousands of health workers took part in the drill that tested the end-to-end testing of the actual vaccination process. The health minister was in Chennai to review the dry run, and he's promised a smooth national rollout.
The battle against novel coronavirus has entered a decisive phase. On Friday, India undertook the biggest rehearsal for what would be the world's largest vaccination drive. The mock drill was conducted in 33 states and union territories simultaneously. The trials featured end-to-end testing of the entire process. It included uploading beneficiaries and site details, verification of documents, and vaccination itself.
This auditorium, they will be made to sit for about 30 minutes. All those who have gone through the vaccination process, and doctors will be monitoring their health. So very simple procedure: registration, vaccination, and observation, following which a person who has undertaken the vaccine will be allowed to go home.
Union Health Minister Dr. Harshvardhan visited General Medical Store Depot in Periyamedu in Chennai, one of the 4 national vaccine storage facilities to take stock. The other 3 are in Mumbai, Kolkata and Karnal.
I think we need to salute our coronavirus. We need to salute our scientists. We need to salute the leadership of our Prime Minister Shri Narendra Modi ji, who has inspired everybody, cutting across anything, across all spectrums.
We're standing inside one of the very important places currently in Chennai, in a place called Periyamedu, and this is actually a vaccine storage spot. We're walking from a dry storage region to the cold storage region, and these are the containers which you see are going to hold the vaccines. And once you enter, you could see that, this location on one side, they have been completely dedicated for COVID-19 vaccine. The temperature that is maintained inside this place is actually 2 to 8 degrees centigrade, and these are the sensors that actually are collecting the data and giving it to the officials. These sensors are directly connected to various departments, and that way it's being monitored.
The mega exercise tried to ensure that the minutest details are attended to and any chinks in the chain are fixed.
This is Delhi State Cancer Institute Hospital. It's part of the Delhi government, and there are officers at the first point of contact that will be looking at filling up forms and details. So these details will be linked with the government's CoWIN app that has been made the one-point center for all information and database.
The government aims to vaccinate 30 crore priority individuals by August 2021 and 50 crore private individuals by 2022 end. The SBI think tank says India will require around 56,000 to 72,000 crore rupees to administer vaccine to 80 crore people. The SBI research pegs the administration cost as 100 to 150 rupees per dose and cost per dose at rupees 250 to 300 per person for Serum Institute's Covishield. This means the per person cost would be around 700 to 900 rupees. 2020 was a lost year. A vaccine is crucial to get normal lives back on track. Now it's just a matter of time before India gets a shot in the arm. Bureau Report, India Today.
One of my biggest concerns is how do we ensure that when the actual vaccination process starts, there isn't a free-for-all? Because people have been locked up, Professor Sareen, for more than a year. They are itching to go out. They think that the vaccine is the key to unlocking the door, which has been shackling them all this while. How do you ensure that this doesn't turn into a Sam Dam Dand Bhe, the free-for-all, do what it takes, get hold of that vaccine so that your life can get back on track?
I think your fears are true, genuine, and it is everyone's fear that riches and the rich people might take all the vaccine. This is a fear, common fear. But I think the way the planning has been through the governments, through the states, through the districts, the lower levels also is very meticulous. We have to abide by the way the things have been planned. And I would like to draw 2 or 3 things to your mind. First is the vaccine. Second is the process of vaccination and rollout. And third is community participation. I think it is this which is lacking. I'll give you some examples. France, despite having the vaccine, had 0.01% vaccination. US, despite having all the 17 million vaccine dosages, only could vaccinate till, let's say, yesterday, 5.3 million only. So the question is, despite everything, 2/3 of the people never showed up. Britain has just done 1% or so. Israel has done 16%. So the question is, it is the participation in an orderly manner by the community, not by Sam, Dam, Dand, Bhed, that will make the difference. And today, I would like to emphasize it is the speed with which you can vaccinate. Because once the mutant virus, which is a fear in my mind, in 3 months can become spiral out and we have more and more cases, before that, we should be able to vaccinate as many as we can, at least the very first dose. The important point is not those who get vaccinated. Let's say I do not want to get vaccine, I do not get enrolled. There would be a list of, let's say, 10%, 20% of saying no, no. Those who say no, no will be our biggest worry. Once they get a infection of any strain, any mutant virus, they can become really a dangerous thing. So therefore, total community participation is the key to our success. I am sure vaccine would be enough for all of us. But what we need is now orderly, complete participation and get your numbers enrolled. Do not miss your appointment. Do not mess up. Do not do a fraud. And then you will see. Otherwise, we may have a very different situation. We need order, we need discipline, we need commitment.
At the start of the show, I showed you how a group of scamsters is trying to extract data and make it seem to people that they can sign up on this app that actually doesn't exist. But on the ground, in some localities now, efforts are being made to get in touch with senior citizens through the Resident Welfare Association so that the local authorities have a list of those who should line up, apart from healthcare and frontline workers. It's these senior citizens who will be administered the COVID shot in the first phase of immunization. So I want to give you a sense of the effort that's being made, the real effort that's being made to try and ensure that we have a registry that's ready. Once the shots come in, then we can get the vaccination program actually rolled out. Take a look at this report.
Delhi is gearing up for the vaccination program. A dry run was conducted in the capital to test the delivery system. Around 4.2 million people above the age of 50 have been identified for the first phase of vaccination. The Delhi government has sought help from the various resident welfare associations in the city for the mass vaccination drive. 9 lakh health and frontline workers are amongst those who will get the first jab. Delhi's Vasant Vihar Welfare Association is amongst those which has been contacted by the Delhi government to provide data.
Day before yesterday in the evening, we got an advisory from the Delhi government wanting that they're saying they wanted to create a database on 3 lines, 60 and above, 50 to 60, and the third, which they did not mention but which is there in the papers, less than 50 but serious comorbidities. So we are collecting that data.
The RWAs are key to the program since they have ready data of residents who are eligible for the first dose.
Resident Welfare Association, they play a very, very important role in any of the healthcare program, including our normal immunization program, unless there is community support. And this is a new program with new virus. So challenges are more.
Identifying, contacting and delivering the vaccine is a massive challenge that state governments will face. That is where help from RWAs becomes crucial.
Delhi government is planning to vaccinate 1 lakh people in a day. So one should hope that the joint efforts by the government and RWAs will make Delhi corona-free city. In New Delhi, with cameraman Kripal Singh, Poonam Sharma for India Today.
Here as well, Professor Sareen, there's a lot of confusion because in some instances, the RWAs have been contacted by local authorities and then they've started drawing up these lists. In some instances, they're drawing up lists by themselves and then nobody's really told them to, and even the criteria isn't clearly defined. How do you ensure that there is clarity around these issues? The people know who's eligible, how will they be eligible, where do they actually need to go, because you've got all these lists being drawn up. And yet at this moment at least there isn't adequate clarity of when and how the vaccine will be administered.
Well, phase 1 is for healthcare workers. For Delhi is about, let's say, about 2 lakhs or so, 200,000 people for healthcare workers. So if we are vaccinating, I guess 100,000 in a day, we would be able to finish in 2 to 3 days. The numbers are, if you are vaccinating 100,000, you will require, per center is about 100, so you will require 1,000 centers to be active. So if we are lucky and we get participation in 2 to 3 days in the large hospitals, the healthcare workers could be done. And then the Resident Welfare Association support must be there. They should have their list ready. And I'm sure the government is reaching out to them very soon. So they would be in the second phase. So at least they should do their job and say, look, we have 50 and above, 50 and below with comorbidities, those who are in a high-risk category, all those are very well defined and published. RWAs are the backbone. Without them, we will not be able to reach out to the communities.
Okay, I'm going to slip into a break. When I come back, we'll go across to the second big investigation we're putting out tonight. This is about China's loan trap being exposed. Indian borrowers falling prey to Chinese apps that are offering instant loans. Then people get caught in a debt trap. It's terrible. If you haven't heard about it, you're probably living in an igloo because this is happening en masse. It's happening to people nationwide. The scam now running into the hundreds of crores according to investigation agencies. And there are Chinese nationals who are behind it. We'll get you details. This Big India Today exclusive coming up on the other side of a quick break. Stay with us.